Did you know that certain medications you might be taking every day could increase your risk of severe dementia? That's right, while we often trust our medications to help us, some could be putting our brain health at significant risk. It's a startling reality that certain common medications, ones many of us might not even question, are linked with cognitive decline and could lead to dementia. This isn't about scaring you away from modern medicine, which has countless benefits, but about making you aware. Knowing the risks associated with these medications and understanding how to manage them could protect your memory. Remember, losing your memory or cognitive functions isn't an unavoidable part of getting older. Many studies suggest that with the right precautions and lifestyle choices, you can maintain robust brain health well into your later years. Today, we're diving deep into the 8 common medications that could be silently affecting your cognitive health. Stay tuned to make sure you are informed and ready to take action if needed. Number 1. Omeprazol, proton pump inhibitor. Omeprazol is a medication widely used to treat conditions like heartburn, acid reflux, and gastric ulcers. It belongs to a class of drugs known as proton pump inhibitors, PPIs, which work by reducing the amount of acid your stomach produces. While effective, there are serious considerations to take into account, especially if you're using it over a long period. Research has raised concerns about the potential long-term effects of omeprazole on brain health. Studies indicate that prolonged use of this medication could be linked to an increased risk of developing dementia. For example, evidence suggests that about 10% of individuals using omeprazole may experience memory loss after 3 years. This figure grows alarmingly to 33% who may suffer from cognitive disturbances after 4.5 years of use. The mechanism behind these troubling effects might involve 2 critical aspects of brain health: vitamin B12 absorption and the balance of gut microbiota. Omeprazole can interfere with the body's ability to absorb vitamin B12, an essential nutrient that supports nerve function and brain health. Furthermore, it may alter the gut microbiota, a factor increasingly recognized for its influence on cognitive functions through the gut-brain axis. Given these potential risks, it's crucial to approach the use of omeprazole with caution. If you or someone you know has been using this medication for an extended period, it might be time to consult with a healthcare professional. Discussing the possibility of reducing the dose or exploring alternative treatments is advisable. Sometimes, managing the underlying issues like heartburn or reflux through lifestyle and dietary changes could reduce or eliminate the need for such medications. Number 2. Anticholinergics. Anticholinergics are a class of drugs commonly prescribed to treat various conditions including allergies, depression, and urinary incontinence. These medications work by blocking the action of acetylcholine, a neurotransmitter that is essential for many functions of the body, including memory and learning. While these drugs can be effective for managing specific medical conditions, it's crucial to understand their potential risks, especially when used long-term. Studies have shown that prolonged use of anticholinergic drugs is associated with significant risks to brain health. One of the most concerning findings is that long-term use can increase the risk of developing dementia by as much as 54%. This is particularly alarming because acetylcholine is not only vital for day-to-day memory and learning, but also for the overall cognitive function as we age. Some common examples of anticholinergic drugs include first-generation antihistamines like diphenhydramine, which is often used to treat allergy symptoms, certain antidepressants such as amitriptyline, and medications like oxybutynin, which are prescribed for urinary incontinence. These medications, while helpful for their intended uses, could pose a significant risk if used extensively over a prolonged period. Given these risks, it's important to approach the use of anticholinergic medications with caution. If you or someone you care about is using these medications, especially on a long-term basis, it is advisable to consult with a healthcare provider. Discussing the potential risks and exploring safer alternatives or strategies to minimize their use could be crucial steps. For some conditions, there may be other medications or non-pharmaceutical treatments available that do not carry the same risks for cognitive health. It is essential not to abruptly stop any medication without professional guidance. Always consult with a doctor who can help you weigh the benefits and risks and can guide you towards the best treatment options tailored to your health needs. Being informed and proactive about your medication choices is a key part of maintaining both your physical and cognitive health. Number 3. Corticosteroids. Corticosteroids are powerful medications commonly prescribed to manage various medical conditions such as asthma, allergies, autoimmune diseases, and inflammatory disorders. They work by mimicking the effects of cortisol, a natural hormone produced by your adrenal glands, to suppress inflammation and regulate the immune system. While corticosteroids can be highly effective in controlling symptoms and improving quality of life, their long-term use comes with significant concerns, particularly regarding mental and cognitive health. When used over an extended period, especially in oral form, corticosteroids can lead to several adverse effects on brain function. These include disorientation, confusion, depression, and anxiety. Such symptoms can significantly impact daily life, affecting your ability to think clearly, make decisions, and manage emotions effectively. The changes that corticosteroids cause in the brain are partly due to their impact on cortisol levels. Excessive artificial cortisol from medications can disrupt the natural balance of hormones, leading to potential damage to neurons, nerve cells, in the hippocampus, an area of the brain crucial for memory and learning. The mechanism behind these effects is complex. Cortisol is known as a stress hormone because it helps your body respond to stress. However, when its levels are artificially elevated for a long time through medication, it can lead to the degradation of sensitive neural structures and impair the brain's ability to function properly. This degradation can manifest as memory problems and other cognitive impairments. Given these risks, it's essential for those on long-term corticosteroid therapy to be under close medical supervision. Healthcare professionals can monitor for any adverse cognitive and psychological effects and make necessary adjustments to the treatment. This might include gradually reducing the dose of the medication to the lowest effective level or switching to alternative treatments that carry fewer risks for cognitive health. If you or someone you know is on corticosteroids and experiences symptoms like confusion, memory loss, or mood changes, it's important to discuss these concerns with a doctor. Managing the underlying condition while minimizing potential side effects is a delicate balance, but crucial for maintaining both physical and mental health. Number 4. Benzodiazepines. Benzodiazepines are a group of medications commonly prescribed to treat conditions such as anxiety and insomnia. Some well-known examples include alprazolam, diazepam, and lorazepam. These drugs help calm the nerves and can be very effective in managing severe anxiety and sleep disorders in the short term. However, their long-term use carries significant risks, particularly concerning cognitive health. Research indicates that prolonged use of benzodiazepines can double the risk of developing Alzheimer's disease, a severe form of dementia. Additionally, these medications are associated with various neurological symptoms such as memory loss, difficulty concentrating, and disorientation. These effects can significantly impair daily functioning and reduce the quality of life. The mechanism by which benzodiazepines affect cognitive health involves their impact on neurotransmitters, the chemicals that help transmit signals in the brain. Specifically, benzodiazepines may disrupt the function of neurotransmitters that play a key role in the formation and retrieval of memories. Furthermore, these drugs can affect the sleep cycle, which is crucial for memory consolidation. Sleep is a time when the brain processes and solidifies memories from the day. Disruption in this process can lead to poor memory retention and cognitive decline. Given these risks, it is highly advisable to limit the use of benzodiazepines. If you or someone you know is using these medications, especially for an extended period, it's important to consult with a healthcare provider about safer alternatives. Non-pharmacological treatments, such as cognitive behavioral therapy, CBT, can be effective in managing anxiety and insomnia without the risks associated with benzodiazepines. CBT and other therapeutic approaches address the underlying causes of anxiety and sleep disturbances, providing long-term relief without adverse side effects. Number 5. Amphetamines. Amphetamines are a class of medications primarily used to treat attention deficit hyperactivity disorder, ADHD. These drugs help improve focus, attention, and control behavior by increasing the levels of certain neurotransmitters in the brain, such as dopamine and norepinephrine. While they can be highly effective in managing symptoms of ADHD, there are serious risks associated with their long-term use that need to be carefully considered. Prolonged use of amphetamines can have several adverse effects on cognitive health. Studies have shown that long-term users may experience memory loss, decreased motivation, and reduced cognitive performance. In some cases, these effects could lead to potential permanent brain damage. These risks are particularly concerning because amphetamines, by boosting neurotransmitter levels, can lead to dependency. This dependency can exacerbate the negative effects on the brain, as the natural production of these neurotransmitters becomes suppressed and the brain relies more on the drug. The mechanism behind these cognitive risks involves the way amphetamines work in the brain. Initially, they increase focus and attention by elevating dopamine and norepinephrine levels, which is beneficial for short-term treatment. However, over time, this constant stimulation can lead to neuronal fatigue and potential damage. Essentially, the brain's chemistry is altered, and its ability to function normally without the drug's presence can decrease, leading to long-term cognitive challenges. Given these potential risks, it is crucial to approach the use of amphetamines with caution. If you or someone you know is using amphetamines to treat ADHD, it is essential to have strict monitoring by healthcare professionals. Regular checkups can help assess the drug's effectiveness and monitor for any cognitive or behavioral changes that may indicate adverse effects. Additionally, considering non-pharmacological alternatives for ADHD treatment can be beneficial. Therapies such as cognitive behavioral therapy, behavioral management techniques, and lifestyle changes like exercise and diet can also significantly improve ADHD symptoms without the risks associated with amphetamine use. Number 6. First-generation antihistamines. First-generation antihistamines are medications commonly used to relieve symptoms of allergies and colds. Some well-known examples include chlorpheniramine and diphenhydramine. These drugs work by blocking the action of histamine, a substance in the body that causes allergic symptoms. While they are effective for short-term relief, there are significant concerns about their use over a long period. One of the serious risks associated with long-term use of first-generation antihistamines is cognitive impairment, including an increased risk of dementia. This is particularly concerning for older adults or individuals who use these medications frequently. The reason for these cognitive risks lies in the anticholinergic effects of these drugs. They block acetylcholine, a neurotransmitter that is crucial for memory and learning. When acetylcholine is blocked, it can lead to difficulties in forming new memories and retrieving existing ones, which over time can contribute to cognitive decline and increase the risk of dementia. The mechanism by which these antihistamines affect the brain involves their strong anticholinergic properties. Acetylcholine plays a vital role in many aspects of cognitive function, including attention, learning, and memory. By inhibiting this neurotransmitter, first-generation antihistamines can impair these cognitive functions, potentially leading to long-term deterioration in brain health. Given these potential risks, it is important to use first-generation antihistamines with caution, especially for long-term treatment. If you need to manage allergy or cold symptoms over a prolonged period, it is advisable to consult a healthcare professional. There are safer alternatives available, such as second-generation antihistamines like loratadine, which do not have the same strong anticholinergic effects and are less likely to affect cognitive functions. Number 7. Tricyclic antidepressants. Tricyclic antidepressants, TCAs, are a group of medications used to treat depression. Some common examples of these drugs include amitriptyline and nortriptyline. While they can be effective in managing symptoms of depression, particularly in cases where other medications have not worked, there are significant risks associated with their long-term use, especially regarding cognitive health. One of the major concerns with the prolonged use of TCAs is their impact on memory and overall cognitive function. Research has shown that long-term use of these medications is associated with memory loss and a more rapid decline in cognitive abilities, particularly among older adults. This cognitive decline can affect daily functioning, making it difficult to remember new information, recall past events, and perform complex tasks that require concentration and focus. The mechanism behind these effects involves the way TCAs interact with neurotransmitters in the brain. While these drugs primarily work by blocking the reuptake of serotonin and norepinephrine to help elevate mood, they also block acetylcholine, a neurotransmitter that is crucial for memory and learning. Acetylcholine plays a key role in processing information and forming new memories. When TCAs inhibit this neurotransmitter, it can lead to disturbances in cognitive processes, contributing to memory problems and cognitive decline. Given these risks, it's important for patients and healthcare providers to carefully consider the use of tricyclic antidepressants, especially for long-term treatment. If you are using TCAs and experiencing cognitive side effects, or if there's a concern about the potential impact on your cognitive health, it may be wise to consult with your doctor about alternative treatment options. Safer alternatives, such as selective serotonin reuptake inhibitors, SSRIs, like fluoxetine and sertraline, are often recommended because they have a lower risk of affecting cognitive functions. SSRIs are newer types of antidepressants that also help regulate mood but have a more selective action on neurotransmitters, thereby minimizing the risk of blocking acetylcholine. Number 8. Statins. Statins are medications widely used to lower cholesterol levels and prevent cardiovascular diseases such as heart attacks and strokes. They are among the most commonly prescribed drugs globally due to their effectiveness in reducing cardiovascular risk. However, there is a growing discussion about the potential cognitive side effects associated with their use, particularly concerning cognitive decline. Some research suggests there might be a link between statin use and cognitive issues, such as memory loss or confusion, although the evidence is not consistent. The studies that do suggest a connection point to how statins may impact the brain's function over time. It's important to note that while some patients report these symptoms, others do not experience any cognitive side effects at all, highlighting the variability in individual responses to statin therapy. The possible mechanism behind the cognitive side effects lies in how statins work. Statins reduce cholesterol levels by inhibiting an enzyme involved in cholesterol production. While lowering cholesterol is beneficial for heart health, cholesterol also plays a crucial role in the brain. Cholesterol is essential for the formation of connections between nerve cells and for maintaining the integrity of cell membranes. It's hypothesized that by interfering with cholesterol production, statins might inadvertently affect the brain's cholesterol levels, potentially impacting cognitive functions. Given these considerations, it's important for individuals taking statins to carefully weigh the cardiovascular benefits against the potential cognitive risks. If you are on statins and begin experiencing memory problems or other cognitive changes, it's crucial to discuss these symptoms with your doctor. Not all cognitive symptoms are due to statins, and they could be related to other underlying conditions or factors. Furthermore, it's advisable for healthcare providers and patients to monitor cognitive health regularly, especially if there are initial symptoms or risk factors for cognitive decline. In some cases, adjusting the dose or switching to a different statin may alleviate the symptoms. In other situations, exploring alternative cholesterol-lowering strategies might be considered, particularly if the cognitive side effects are significant. In conclusion, protecting brain health is crucial as it significantly impacts our overall well-being. The brain is our most valuable asset, and making informed decisions about the medications we use is key to maintaining its health. It's essential to consult with healthcare professionals before making any changes to your medication regimen. They can help you weigh the benefits and risks and guide you towards safer alternatives if necessary. Additionally, adopting a healthier lifestyle can play a significant role in reducing our dependence on medications and safeguarding our cognitive health. Remember, staying informed and proactive about your health can make a profound difference. Subscribe to our channel for more insightful content on health and wellness, and join us in making well-informed health decisions. Together, let's keep our minds sharp and our bodies healthy.